So, in this video, we're going to discuss some of the most common reasons why a hair transplant surgery may fail. Stay tuned, we're going to talk about that right now. Welcome back to the channel. Good to see you again. Thanks for being a part of this with us. So today's video, we're going to talk a lot about reasons why a transplant procedure may fail. When I say the word fail, it doesn't mean that nothing grew or anything like that specifically. It can be that too. So a failed hair transplant, in my opinion, is anything that didn't produce the results that you or I were expecting for your results after the transplant procedure was done. So in my view, doing this over 20 years, just hair loss, just hair transplants, some of the most common causes that I've seen here in my practice and also coming from other people are these that I'm going to discuss today here. So hopefully this will help you a little bit understand if you're out there facing a procedure that didn't produce the results that you wanted for whatever reason, maybe some of the causes will be here and you'll be better educated for the future. The first cause that I see a lot of times is that the hair loss itself was not diagnosed correctly, right? So not every hair loss is equal. Not all hair loss is treatable with a hair transplant procedure. In fact, the vast majority of hair loss out there is not treatable with a transplant. I recorded another video in the past where I discussed that actual misconception that people have is that hair transplants are our treatment for hair loss. They're not really a treatment per se. They are a fixing of a hair loss problem. So in other words, we use transplants to refill areas that were lost. But to prevent loss, to really treat hair loss or the androgenetic or male or female pattern hair loss, we need to treat with medications. So I'm going to put a link to the video here so you can go watch it. But anyway, so if you don't diagnose the hair loss correctly, you may perform a hair transplant in an area or in a patient that should not have been transplanted. And I see this sometimes because in many practices out there, not here with us because I do see every single patient for consultation. In many practices out there, the doctor doesn't see the patient before surgery. The consultation is done by a consultant or a salesperson or someone who has some experience, maybe had transplants themselves, but they're not trained as a doctor to really diagnose hair loss. So sometimes a patient will sort of fall through the cracks and a surgery will be recommended by on a patient that did not have to have that surgery. You know, whether this practice is right or wrong, I have my own beliefs, but you know, judge it for yourself. But I make it a point to see all my patients because I've been studying hair loss for many years. I've been talking about hair loss and teaching about hair loss for many years. So certain things can be subtle and you need to be looking for them so that you can diagnose correctly. If you diagnose correctly, then of course the chance of having a successful outcome is better. Second reason that I think is that there are sometimes poor understanding of hair and scalp anatomy. What does that mean and how is that important? Well, as a surgeon, you need to understand anatomy, right? So you can't be a surgeon if you don't understand anatomy and also physiology. If I'm operating in the abdomen, which was my original training, I need to understand all the organs anatomy, the physiology, how they interact with each other, which structures I'm going to find here or there, right? So in my mind, I have to have an understanding of the landscape, right, if you will, of where I'm operating on. It's not any different from the hair and the scalp. The scalp has many different layers. It has, you know, nerves, it has veins, it has arteries, it has the skull, it has some important structures that I need to avoid. The hair itself has certain depth to it. It has certain structures that need to be protected, that need to be transplanted together with the hair so that we can get an outcome that's favorable. So all this understanding sometimes, if the doctor, if the surgeon, or even worse, if the technician's doing your surgery, yes, that's right, technicians nowadays are sometimes doing hair transplant surgery on you, and you don't even know about that. So make sure that you talk about, wherever you go for consultation, make sure you ask who is going to be actually performing it, okay? So when I'm doing a surgery on a patient, I am thinking about these structures and the depth and, you know, if my structures are intact, if I'm avoiding some of the major blood vessels and the major nerves and everything like that, because all those things are important. They're pretty much the bread and butter of what we do. If I don't understand that correctly, then I may cause damage to your scalp. You may end up having areas that are numb, or you may have areas that, if the blood supply is compromised, you may have areas that actually die off of the scalp. I've treated patients like that before, where they had actual necrosis of the scalp, where the hair and the skin died off. And so these are things that can be avoided and should be avoided. If you have an understanding of things, you are better equipped to avoid them. Another potential reasons for poor outcomes or a failed hair transplant is that there's not an understanding of hair physiology. Hair is a very complex organ, if you will. It's very difficult to understand how exactly hair grows and all the mechanisms, all the cellular interactions, because you have cells of multiple lineages and embryological origins. So it's a very complex structure. When we transplant a follicle or a hair, it looks very simple, but we have to understand what goes on a cellular level, how these things are going to play out in the survival of the graft. I've lectured many times on storage solutions and survival of hair transplants, and we're going to record a video here also soon about the main causes of poor growth or poor survival of hair grafts or follicular units. And to prevent that, you have to understand their hair physiology. So from removing from the scalp, you have to protect them against injury. You're going to deprive the hair follicles from blood flow for a few hours while you wait between harvesting and putting it back into the scalp. So you need to protect them. Once you put them back into the scalp, you need to understand what goes on during the healing phases of the transplant, so you can optimize that so that every hair is protected and provided with good blood flow and good environment for healing. So all these things I need to understand, right? You don't need to understand that. You're a patient. It's my job to have that information so that I can apply that to you and give you some tips on how to better have better care for your transplants afterwards and how to better have your outcome. So that's a very important thing too. And if you don't have that, or if the person taking care of you does not have that understanding, it can certainly interfere with the results afterwards. Next, it's a poor emphasis on education on patients. That's one thing I see a lot still to this day. And medications like finasteride, we have a video about that here on the channel. Minoxidil, all these things are very, very old. They're not yesterday's drugs, right? So we've been using them for many years. Still, I see patients almost every day coming to the office that have been seen by other supposed specialists in hair loss, and no treatment was recommended, just a surgery. They were ready to sign off on the surgery. Treatments were never mentioned to maintain their hair, to prevent further loss. So if you don't account for that, if you don't educate, if I don't educate you, the patient, on your hair loss, then I'm not doing you a service. And sometimes the education involves not transplanting or recommending against the surgery, right? Not because I'm a hair transplant surgeon, I need to operate on you 100% of the time. There are patients that are turned away from surgery all the time, where I tell them, look, let's do treatment first. Yesterday I saw a consultation on a patient, was on no treatment. He was losing hair very fast. So instead of operating right away, the recommendation I made was, okay, let's do medical therapy first for 6 months, a year, and see how you do on that. Prove to me that you can do it, that you are going to be consistent with it, because if you're not, then my transplants will not provide you what you want on the long term, right? So I have patients that have been with me for many, many years, from the grandfather to the father to the son now, 3 generations of families that are my patients, and I'm very proud of that. And, I think that that's based on the trust that they have, because I never put my financial interests or, anything else in front of the best interests of the patient. So a lot of times I find myself not recommending surgery or delaying surgery until I know that the patient is being treated medically. And that's very important. Education is key, and that's the reason for the consultation in the first place. The other thing is, again, same point almost, lack of recommendation for medical treatment. Medical treatment for hair loss, as I just mentioned, is important. It's very, very important. Whether you're a man or a woman, if you're facing hair loss, medications are going to be involved in your treatment plan, not just surgery. So that's very important too. Another cause is not listening to your concerns and your goals, right? So you come to me and I look at your head and I may see a balding spot, say back here, right? And something in the front. Well, if I just assume that's the area that you want to treat and I make a treatment plan for that and I don't listen to your concerns, I may be going the wrong direction. I've had over the years multiple patients where they didn't care about the area that I was seeing as the thinnest area. They cared about the other areas. Say, for example, they didn't care about the front, they cared about the crown, or vice versa. And if I didn't listen to them, I would probably treat the wrong area, you know? I have seen patients come to me from surgery from other places and they're like, well, I thought he was going to put the hair here, but he didn't. When I woke up, or where the end of the surgery, he had put it somewhere else where I didn't want, or we didn't discuss. So these things shouldn't happen, you know, and that involves conversation, it involves an understanding. I have to listen to you. It's your scalp, it's your hair, right? You're going to be looking in the mirror every day, so I need to do what you would like for me to do, and I need to make sure that your goals are aligned with what I can deliver, and that's expectations, right? Very important in what we do. If I promise you this and I deliver this, you're not going to be happy no matter how good the results are. So you and I will have to be on the same page as far as the expectations of the surgery. And over the years, we've developed the little things that we can use, you know, maybe show you an area of your own scalp where it's thinning so you can kind of see what the results will likely be, so on and so forth. So again, that takes time. In the consultation, we do address all these questions. The next thing that can happen that can actually make a transplant fail is a poor planning of the hair transplant procedure. So in other words, a hairline that's not correct, too aggressive, too rounded for a man, very feminine looking on a man, very young looking on an older man. So all these things are poor planning. Poor use of donor zone as well. Use a lot of the donor for a small area of the recipient area, the balding area. It's not a good planning for now and also for the future. I have to coach you during that process. You don't know. It's my job to teach you that we only have so much hair that we can use, so we need to use it very, very smartly, because if we use it all at one time and then you may lose some more hair in the future, we won't have anything to do anymore for you. So all these things are very important. The other thing I see is poor technical execution of the transplant. Hairs that are transplanted at the right angle, at the incorrect angle and the incorrect direction. Sometimes, again, the hairline is placed too low and the angles are incorrect. It looks horrible. Sometimes, they transplant hairs very close together because they try to pack too close. A lot of the hairs didn't grow and now you have wasted a lot of donor hair. So these things are important. They happen and I see them. And so best thing to deal with complications is to prevent them, right? So we try as much as we can to make sure that we execute and plan everything for you the best way possible so that we can have the best outcome possible. And that should be like that for everything. Again, same point that I just mentioned, poor management of the donor hairs, right? We only have so much donor hair, so it's limited supply. Although we have an area of the recipient area, the area that's balding, keeps enlarging over time. So we have a limited supply of hair for an enlarging area of demand. So that's a quandary that we face as hair transplant surgeons, is that we have to paint a picture, a beautiful picture, but we only have so much ink to do it. And so if we don't utilize that ink the best way we can, you're not going to be happy and I'm not going to be happy either. So sometimes that involves some compromise, right? While we can treat an area really well, we can't treat the whole entire area of hair loss with the donor hair that you have. And I need to explain that to you so that you understand, you can make your decision, and then we're going to be successful. And finally, one thing I see a lot too is patients start their transplants very early. They still have a lot of their own native hair, but it's just starting to thin. And someone goes there very aggressively and puts a lot of transplants in between the existing hair. And what happens is the transplants traumatize a large amount of those hairs, so they lose a lot of hair from the surgery. The transplants grow, but that trauma caused a lot of loss of the native hair that was there. And so at the end, it's a wash. They lost as many hairs as probably were placed. So the surgery didn't produce any visible change because, again, that was a trade-off. that's never a good thing to do. I'm always very respectful with native hair, existing hair. I'd rather be conservative and try to preserve those hairs as much as I can, because I know they're very valuable and we don't want to lose them, and we do that by using medications. And also, I'm very careful sometimes not going in, or if I do, very conservatively going into existing hair, because with the instruments that we have nowadays, if it's done correctly, I can go really close to existing hair and squeeze a hair in between. But there's always a risk of trauma. So if there's not enough space between existing hairs, even though it may be thin, but if the hairs are still pretty close together, I know I'm going to damage them if I try to go in there too aggressively. So again, my job is to educate you on that so that we can make a plan that you understand why I'm not going to go there, even though I see that it's a little bit thin, but we can manage that better with medications versus going with surgery. So these are like the top 10, causes of potential failed hair transplant. So if you're out there and you're facing one of these situations, or you know someone who is, there are solutions. This is not a once and done kind of thing. So complications like this can be managed, can be corrected. They just need to be addressed as soon as possible. So, but again, the best way to treat complications is to prevent them. I always say that. We all can have them as surgeons. We're all going to have problems some here and there, but preventing them and knowing how to deal with them effectively, it's part of what I need to do for you. And so if you like the video, if this information was helpful for you, please click the like button below. It'll help us get that information to other people that might be in the same situation, that might need that information too. If you like the content, subscribe to the channel so you can get alerts on new videos that we post. We usually post once a week or so. And we're here for questions. You can call us, you can schedule an appointment with me. I can do it virtually, I can do it here in the office in Florida. So we're here for you to answer all your questions, okay? But do your homework before you decide on the surgery. That's the least you can do for yourself and for your hair, okay? I'll see you next time. Take care.